The body is made up of trillions of living cells. Normal body cells grow, divide into new cells, and die in an orderly way. During the early years of a person's life, normal cells divide faster to allow the person to grow. After the person becomes an adult, most cells divide only to replace worn-out or dying cells or to repair injuries. Cancer begins when cells in a part of the body start to grow out of control. There are many kinds of cancer, but they all start because of out-of-control growth of abnormal cells. Cancer cell growth is different from normal cell growth. Instead of dying, cancer cells continue to grow and form new, abnormal cells. Cancer cells can also invade, grow into, other tissues, something that normal cells cannot do. Growing out of control and invading other tissues are what makes a cell a cancer cell. In most cases the cancer cells form a tumor. Some cancers, like leukemia, rarely form tumors. Instead, these cancer cells involve the blood and blood-forming organs and circulate through other tissues where they grow. Cancer cells often travel to other parts of the body, where they begin to grow and form new tumors that replace normal tissue. This process is called metastasis. It happens when the cancer cells get into the bloodstream or lymph vessels of our body. Not all tumors are cancerous. Tumors that aren't cancer are called benign. Benign tumors can cause problems. They can grow very large and press on healthy organs and tissues. But they cannot grow into, that is, invade, other tissues. Because they can't invade, they also can't spread to other parts of the body, that is, metastasize. These tumors are almost never life-threatening. Type of cancer. Cancer is not just one disease. There are more than 100 types of cancer. Types of cancer are usually named for the organs or tissues where the cancers form. For example, lung cancer starts in cells of the lung, and brain cancer starts in cells of the brain. Prostate cancer, breast cancer, cervical cancer, and many others. Including childhood cancer, which are cancers that affect children. Risk factors. Many people fear cancer more than any other disease, so hearing that something might cause cancer can bring out strong emotions, especially if it's something you're exposed to on a regular basis. Also, it is very confusing to say what really causes cancer. However, it is better to say that there are some risk factors to cancer, such as smoking and tobacco, diet, physical activity and obesity, virus, age, hormones, cancer-causing substances, sun and other types of radiation, chronic inflammation, immunosuppression, infections. Some carcinogens may raise cancer risk after only a very small exposure, while others might require intense exposure over many years before there's any noticeable increase in risk. For example, heavy alcohol use is linked with an increased risk of several types of cancer, but an occasional beer or glass of wine isn't likely to affect risk. Signs and symptoms. Signs and symptoms are both signals of injury, illness, disease, a signal that something is not right in the body. However, in the case of cancer, one sign or symptoms may not be enough to conclude that someone has cancer. Also, there are many signs and symptoms for different types of cancer. For breast cancer, it's tumor, swelling of the breast, nipple retraction, redness, scaliness, thickening of the nipple or breast skin, nipple discharge, etc. For prostate cancer, it's loss of bladder control, blood in urine, difficulty in urination, and many others. Stage. Doctors needs to know if and how far the cancer has spread from where it started. This is called the cancer stage. For each type of cancer there are tests that can be done to figure out the stage of the cancer. As a rule, a lower stage, such as a stage 1 or 2, means that the cancer has not spread very much. A higher number, such as a stage 3 or 4, means it has spread more. Stage 4 is the highest stage. Treatment of cancer. The most common treatments for cancer are surgery, chemotherapy, and radiation. 10 ways to prevention. Do not smoke, maintain a healthy body, have a healthy diet, limit alcohol, protect yourself against cancer-causing substances, Breastfeeding is good for mothers. Avoid too much sun. Vaccinate against cancer like hepatitis and human papillomavirus and take part in cancer screenings. Conclusion: a diagnosis does not mean the end of life, because there are several people whom have been diagnosed of cancer and they have returned to healthier and productive life after treatment.